Welcome back to my channel, Pattern of Good Works. My name is Donna, and we will be in chapter number 3. We're continuing where we left off on last week. So we're in the book, The Specialty Practice of Rehabilitation Nursing, a core curriculum, the 8th edition. In chapter 3 on page number 34, it starts by talking about the characteristics of an effective team. So an effective team, of course, is going to have well-defined roles. They're going to be having a positive working relationship. They're able to have open two-way communication. They are also trusting, and there's a mutual respect between different team members. There's also going to be a focus on the client and family and caregiver and providing integrated care. And lastly, you will see active listening. And there's going to be time to allow for questions as well as answers, as well as for clarification. We also see on page number 35, you'll see the specific roles of the rehabilitation nurse. You'll see the rehabilitation nurse as an admission liaison nurse. You will see the rehabilitation nurse as a client care coordinator or nurse manager. You'll see the nurse as a nurse educator. You'll see the rehab nurse as a case and care manager. You'll also see the nurse as a clinical spec nurse. And lastly, they have a space for a quality specialist. So we also see on page 35, it talks about regulations, because in order to have an effective team, you need to follow the guidelines from the Centers for Medicare and Medicaid Services. So they are saying Centers for Medicare and Medicaid Services stands for CMS, and CMS is saying at a minimum, an acute inpatient rehab team must have a physician, must have a nurse, must have a therapist, whether it be PT or OT. There's also usually included in there a social worker, and the members of this team must have up-to-date knowledge of the patient, as well as know that they have to meet at least, according to this book publication on page 36, they must meet at least once a week, and the group is led by the physician. And what is their goal? They're trying to identify the patient's goals. They're trying to identify whether or not the patient is meeting those goals. They're also trying to identify any barriers to discharge, and they want to do this in a timely fashion so that if there are any issues, there will be a resolution. They also want the treating professionals, they have to be present at this conference, right? That's very key. And the occurrence of the team conference and the decisions made during the conference will always include an adjustment to goals. Do they need the goals to be adjusted? They will also look again for barriers, as well as make any necessary documents, and all the names of the professionals as well as their designation of those who participated in this group must be clearly outlined on the team conference itself. So we see this is a requirement under CMS. There's nothing that we can do to get around this. There are necessary requirements for subacute rehab as well as for home rehab. They really will be just looking or discussing complexity of the client's case. Conferences, again, are documented in the medical record, and a designated team leader shares the outcomes of the conference with the client for those patients who are on home rehabilitation. Lastly, in chapter number 3, they talk about the Commission on Accreditation of Rehabilitation Facilities. I like to read it. They're otherwise known as CARF. CARF has wonderful ability to ensure that the rehab hospital is meeting those goals. And I think CARF also challenges organizations to use best practice across the nation, across the world, actually. The team provides services that address, according to book Page number 37, the team will provide services that address impairments, activity limitations, participate in restrictions, environmental needs, and the personal preferences of the person served. So CARF is going to outline the responsibilities of the team, which include reviewing relevant reports to facilitate assessment. They're going to see if we're identifying resources, integrating information on available resources into a program planning and implementation. So if you have an amputation program, a spinal cord program, do you have a TBI program? Whatever program you're having, they're looking to see whether or not you're conducting assessments, predicting outcomes, establishing the treatment plan, establishing the discharge or transition plan, and providing services. They want to see, are we flexible? Are we modifying the treatment plan? Are we ensuring that the discipline change based on the needs of the patient? And we will also always make sure that persons served are receiving the most appropriate level of care based on their needs. So CARF requires the team process to be documented in a similar way like CMS, and they also want to ensure that CARF also requires that the team process be documented and that the team meets frequently enough to meet the needs of the person served. Okay, so there are requirements for CMS and there are also requirements for CARF. So in summary, I have to let you know that nursing staff cares for inpatients 24 hours a day, 7 days a week. And often many different staff members come in contact with a particular client and family. But be sure there are going to be CNAs, LPNs, RNs. And I want to take this time to wish all the nurses a happy Nurses Week. And thank you for doing what you do with excellence and with love and with compassion and with a desire to see your patients well. Keep doing a great job, and we continue to forge forward on our CRRN journey. Wishing you all the best. Take care. Be well.